Hi, this is Naturopathic Doctor Patti Sheeley, and today I want to talk with you about your upper digestive organs and how at Looking Glass Integrative Wellness we can help you to optimize your digestive function. And I picked this because there are so many things about the upper digestive tract that it's like, what can possibly go wrong? It's almost like there's so many pieces that have to interact correctly to have a correct function there. It's like, okay, it's almost surprising how many people get it right as opposed to wrong. And so I want to talk with you, what are the players? What can go wrong? How can we help? What can we do about that to optimize your wellness? And so here we go. We're going to start. We actually going to ignore the mouth and throat and pretend like you get to the esophagus. And that esophagus is a tube that goes from kind of after you swallow all the way down to your stomach. And a lot of people have issues in that area, but is the cause right there? Because probably not. It's probably somewhere else, either around or above or beneath or outside. And that's what we're going to talk about today, because a lot of times we experience symptoms in a place that's different from where the actual dysfunction is, which is why we work on the cause here at Looking Glass Integrative Wellness. So I always spend a lot of time educating people. So I thought, hey, why not invite my online audience in for the party? So here we go. So the esophagus is first, and then, so that's this tube. Yes, it's my drawing. I drew through this with my own hands. So anyway, this is the esophagus, and then you have this little red line here, and it is called the gastroesophageal junction, or for short, we just say the GE junction. And that is where a lot of things happen that are super important. We'll get into that later. But then as you go down further, of course, there's your stomach. And so you might imagine this environment here, it's all about the acid. And this environment here does not have the stuff necessary to protect us from all the acid, and that can lead to all kinds of things. And then we have this little yellow structure here. It's not actually yellow in real life. I just changed colors, but that is called the crus, and it's actually a tendon. It attaches to bone deeper down, and it helps aid, keeps all the pieces in place, assuming it doesn't keep all the things out of place. But it's a really important structure as far as making sure the structural integrity of everything happens. Those muscles can contract and have the right effect in our life. So this just anchors that junction there to keep it where it's right, so that whenever your muscles contract to bring food down, and also your muscles to contract to digest food, everything stays in right relationship with each other. And then right here at this line where the gastroesophageal junction is also a muscle. It is called the sphincter muscle. You have a number of sphincters in your body. This one is super important whenever we're talking about something like gastro reflux disease, that kind of thing. So the next question, what could possibly go wrong? And there's actually a lot of things that could go wrong, because this is an elaborate dance, and it's just pretty amazing to me that it works. So I think of the possible problems in terms of mechanical, and that is like the relationships to the different parts. So for example, if this little line here that I was talking about, that is the junction, gets shoved up above this tendon, and you get that junction coming up here, when that muscle, that sphincter muscle that keeps the acid where it belongs, and the initial bolus of food where it belongs, if that muscle is not in correct relationship with this ligament, you can get what's called a hiatal hernia, because the acid from the stomach ends up too high, and that tissue can't handle that. So that is an example of a mechanical problem. You can also have things growing where they don't belong, for example, a tumor, something like that. Or we can have a chemical problem. If your pH balance in your stomach is not correct, and it will, normal pattern of everyday living is it will change. When there's food present, you have more acid. When there's not food present, you have less acid. The dance and the rhythm of that is super important. But interestingly, sometimes people have gastric reflux because their pH is too low or too acidic. But a lot of people don't realize it can also happen when the pH in the stomach is too high and not acidic enough to stimulate this muscle to tighten. That's why there's not one answer for gastric reflux, because there's a lot of things that can go wrong that can cause it. So the question is, and so there's the mechanical things, there's chemical things, there's not enough of a tissue, as in tissue getting eroded, and there's also too much, as in having some kind of a tumor or something like that in place. So we have all kinds of mechanical and chemical issues that can happen. So how can you tell? So that's the question. Well, your MD, and by the way, we respect gastroenterology. We respect all the things that they bring to this table. This is not an either or. This is a both and issue, okay? So the first thing that we can do is we can look at imaging, and that would definitely be in the wheelhouse of a gastroenterologist, and they can get really great information. Now, the thing you have to realize is usually the imaging is usually a fiber optic device that they put down your throat. Usually we're a little bit asleep for that, down your throat, to take images of all of these structures on the inside as well as the stomach. But those images tell us things in here. They don't tell us information about what's outside the tube. It's literally a photograph, and you can see the video. It's actually very cool, and it has amazing information. But to see what's outside the tube, that's a different kind of imaging. We only answer the questions that we test for, and sometimes that can be difficult to know exactly what questions to ask and exactly what tests to do. So we gauge it based on symptoms and other things. And then the next thing, of course, how can you tell, is we can look at symptoms. And symptoms are, yeah, it hurts or it doesn't hurt or whatever, but it's also important to understand what are those symptoms are associated with. Is it in an environment where, like, I'm experiencing a lot of stress and then my symptoms get worse? Or is it a certain kind of food? Or is it, yeah, I took this thing but not that thing? Or is like, oh wow, I was dehydrated and then I couldn't digest my food right. So it's really important to look at our symptoms, but also the context of those symptoms to go like, well, this might be related to that whenever we're trying to help somebody get better from gastric disease. And then the other one is, of course, labs. That looks at the chemicals you're putting out, the reaction of your immune system. Maybe we have a parasite, maybe we have not the greatest microbiota. There's a lot of things that we can evaluate in labs. So the issue is, like, understanding the GI tract is in some ways one of the more challenging systems of the body, because everything moves. Any lab is as good as the moment at which that happens. But if you have a problem while you're digesting food and you're not having the problem when you're not digesting food, it can be very, very difficult to get the information that you need. So anyway, there's all kinds of, I get a lot of information for that reason, because I ask questions and I take time with my clients to make sure that we can get all the information. Now, what do we do? If we have a mechanical issue, like, for example, if I have an individual and let's say they have a hiatal hernia, and let's say that thing is just giving them fits for a long time, there are what we call physical medicine. There are non-invasive means that we can use, and there's more than one of them. There's things you can do at home, but there's also things we can do in the office to actually encourage these structures to relocate themselves, which is like really amazing and crazy. But yes, we can actually encourage a proper relationship of those things and talk about, like, what might have happened in your life that can cause those things to be not in the right relationship with each other, and we can correct that. A lot of times we will see, for example, a physical movement of this area as a result of pregnancy. I know of women that are like, I had great digestion and then I got pregnant and now it seems like my gut is just like, that part of my gut is wrong. Well, during pregnancy, a lot of our internal organs actually move from this direction or that direction to make room for that baby, and then sometimes they don't move all the way back. The good news is usually that is relatively simple to address. That's just one example. Also, if somebody does a lot of strenuous lifting or breath work with their day-to-day life, it can actually affect this, because along here, and I didn't draw it, but along here is your diaphragm, which you kind of need to breathe, but also the diaphragm relationship in there, whenever we do a lot of breath work, it can have an influence on the rest of the structures that it surrounds. And so some of those things are important just to be mindful of and help the body to do as best as it can. So we are going to talk about motility. Which is a muscle contraction that happens from your mouth all the way down to elimination. And helping that to work correctly is really major. And there's lots of ways that we can just go like, you know what, let's help motility happen well, so that the things that need to move are moving in the order and in the way that they're designed to do. Because if they don't, guess what happens? Things back up, things go too fast, it's not a good scene, things get ugly fast. So that's one of the things we want to work on. Second one, we want to address, of course, the chemical side, so the pH. And I'm also going to put enzymes. Okay, so your pH balance, as I said earlier, sometimes we have problems with this area of the body because we have too much acid. And that's kind of the more common place where we default and go like, I'm going to take my antacid. But sometimes you have a problem that feels in your body as if it is too much acid. And the reality is this muscle is not receiving adequate, the nerve actually that innervates the muscle is not getting adequate stimulation to ensure that it gets enough of a contraction. So there's all kinds of things that can happen, and that's why you want to talk to somebody and let them walk you through so that we can identify what is the dysfunction there and what can we do about it. But absolutely, pH is an important aspect. Also, our pancreas, which I didn't put in the drawing, but our pancreas and our liver both have really important roles in making sure that the stomach has the right, well, the entire digestive tract, because it's all connected. And if you're not putting out adequate amounts of the right enzymes, it can be very difficult to break down the food and move it along in the way that it's designed to do. So that's in the chemical sort of level of what we do. And then, of course, after that, we get into medication. Or surgery. Going back to the theme of hiatal hernia, those typically you will get, in that case, you'll get a bulge. We'll draw a little bulge there. You'll get a bulge. Now, if it's a tiny little bulge, that's whenever the in-office things that I'm able to do as a naturopathic doctor can help. If that bulge gets past a size and a shape and a dimension that it's not that way, then absolutely I am the first person on team get the surgery. Because you do not want to develop cancer because you have left a hiatal hernia unattended. But very, very often in clinic, we can do things at a lower force intervention. So what I tell people is absolutely get the imaging. Absolutely, if that surgery is necessary, do the surgery. And there's a lot of things for which I would be completely in favor of it. But if you've been told or are on kind of team, well, let's just wait and see, and you're beginning to get worse, instead of just like letting it get so bad that you're almost dead is not a good look for anyone. Why not come and see what I can do to help you as a naturopathic doctor? Because a lot of times I can do lower force intervention that can stop and maybe even reverse some of those issues. This is for entertainment purposes only. I do not diagnose or treat illness in the state of Oklahoma. Here I serve as a life coach, but I am happy to try to coach you through some of the issues that you may be having with that upper gastrointestinal area. In wellness, this is Naturopathic Dr. Patti Sheeley inviting you to like, subscribe, and share. Have a great day.